Good morning to you and welcome back to Al Jazeera America. I'm Morgan Radford, live in New York City. A major breakthrough in the fight against Alzheimer's. British scientists say they've developed a blood test that can actually detect who's most vulnerable to getting the disease. As Al Jazeera's Phil Lavelle tells us why this test may be a game changer.
Some would say Derek was one of the luckier ones. He was starting to forget things, but at least he knew why, and that bought him time.
I thought, I've gone the same as my mum. I've got this Alzheimer's or whatever.
Derek's wife, Yvonne, began fighting for drugs, and that early diagnosis was crucial, leading to vital treatment.
I've done, I was saying myself, I think I've done pretty well for 6 years. It slows it down.
At times we will argue, he's still with us, and he can take part in a lot of things, which is very nice, because I've seen some of them. And now they're in homes, and it's so sad.
As with many illnesses, there is no cure for Alzheimer's, for dementia. Slowing it all down is as close as doctors and scientists can get. But they've been struggling because symptoms can take a decade to appear after the disease kicks in. Too late. Which is why one announcement out of London, a crucial result about a critical test, is giving hope. This research has taken a decade to get to this point. It concentrated on 10 proteins which are found in the blood. Now, the test can predict whether Alzheimer's is coming in the next 12 months in people who suffer memory problems, and it is 87% accurate. It could be on sale within 2 years at anywhere between $50 and $200. But that all depends on one crucial element. Scientists need more volunteers, or, in other words, more people willing to be tested and face being told they will develop an incurable disease.
Where some people would like to know and help the current drug development process, and some people go, so if there is no cure or therapy at the moment now, why would I want to know? We won't be able to do any of this work if we don't have the samples from the people that are kindly volunteered.
You did have a moustache. I think you...
I say I rather care.
For Derek and Yvonne, early diagnosis has quite simply given them more years together. He insults her.
By fat control, aren't you, darling?
I knew that would come into it.
She's just thankful he still can. Phil Lavelle, Al Jazeera, London.
So joining us now to discuss this test, which can reportedly detect who will develop the onset of Alzheimer's, is Dr. Devi Nambiaparampil from the NYU School of Medicine. Dr. Devi, thanks so much for being with us.
It's great to be here.
So who exactly should get this test?
People who are interested in participating in research, people who are interested in helping these scientists can volunteer to get this test, but I don't think it's for everyone. So it is very promising, but that 87% number, it's a little bit low for actually getting the accurate diagnosis of Alzheimer's. So just to give more background, when you get a test done like this, especially for such a, deadly disease, such an important condition, you really want the test to do two things. So it has to test positive in people who have the disease, and it has to test negative in people who don't have the disease. So that sounds straightforward, but it's actually a little bit more complicated. If you think about someone who has Alzheimer's, where the test maybe comes back negative, then they're not getting the standard treatments for Alzheimer's. They are spending time thinking that they don't have the disease when they really could get treatment. And if it tests the other way, so it tests positive in someone who doesn't have Alzheimer's, then you either have someone who's healthy thinking that they have a deadly, incurable disease, or they
Which is uncomfortable.
Of course, yeah. And they don't have it, or maybe they have some other type of dementia that can be treated, treated a different way, and they waste time getting that treatment. So 87%, if you think about it that way, more than 1 out of 10 people is getting the wrong diagnosis. So it is very promising. I mean, after a decade, that's exciting to be this close and to come one step closer to finding, a real blood test that can be offered to people. But it's not there yet, because that's too many people that would have potentially a wrong diagnosis.
So should you only take the test if you have a history of Alzheimer's?
Well, if you have suspicion of Alzheimer's, the test may help you to kind of cement that. But I would say you still want to get the other test to make sure you don't have something else that can be treated. Sometimes people can look like they have Alzheimer's when they have, let's say, thyroid disorders, some other abnormalities. Sometimes even depression can look like Alzheimer's because people might have problems with their memory. They might look a little disoriented and stuff. So it's still important to kind of take a look at the whole spectrum and really get the standard testing for Alzheimer's, which is more clinical.
So given those reservations. What would you
Yeah.
say to those people who say, look, I'm actually too scared to know whether or not I actually have it? Would you think they should still try the test and see?
If they have reservations, I would say they can hold off. I mean, getting the test isn't going to necessarily change what's happening. So if they have suspicion of Alzheimer's, right now we don't have a cure and we don't have treatments that reverse Alzheimer's, so they're not missing out on something. But there are treatments that can help with symptoms. There are things that can help with their memory, for example. So they could still get those treatments without officially having the diagnosis. So I wouldn't push anyone to get the test. It's only people who are really eager to get it done, and it's important they understand what the implications are, that they might have a false positive or false negative.
But still a game changer for those who
Definitely.
do want to do it. Okay, great. Dr. Debbie Farmfield from NYU, thanks so much for being with us
Thanks
today.
for having me.
Appreciate you.